If you have trouble sleeping at night or your bed partner complains about your snoring, you might have sleep apnea, but it's not something you can ignore because it might affect other aspects of your health as well. We sat down with a sleep disorder expert to find out more.
Obstructive sleep apnea is a difficulty with breathing during the night when you're sleeping, and it can be anything from completely stopping breathing at night to where you simply have trouble breathing to where your brain wakes up or you may wake up or your oxygen level drops during the course of the night. But it can have a big impact on a lot of other disease processes, things like high blood pressure, diabetes or high blood sugar, elevated cholesterol levels, heart disease. The symptoms that kind of lead people to come into the sleep lab for diagnosis of this would be something like snoring, which is common. Obstructive sleep apnea happens for two reasons. One is when we're asleep, our muscles tend to relax. And with our muscles relaxing, your tongue being the big muscle, it actually tends to fall back and close off the opening of our airway. And that can lead to snoring and trouble breathing at night. And then the other issue is because, again, our muscles are relaxed when we're asleep, is that the breathing tube, which starts at the back of the throat and goes down to the lungs, can also collapse on itself. Typically, there's two different types of sleep tests that we order to diagnose someone with sleep apnea. And the first one is a home sleep test, where we simply evaluate how you're breathing overnight with something similar to an oxygen cannula that measures the flow of air that you create at night. And then we also measure your oxygen level. The other test, which we call an in-lab sleep test, is much more extensive. And what we do during that is we monitor your brain activity. So you have a number of brain electrodes that are monitoring your brain waves. We also take a look at your heart activity in addition to your breathing, as well as any kind of movements you might be having at night. In our particular lab, and I think most labs, have a video camera just to evaluate if you do have any abnormal movements that are happening as well. You know, for people who have sleep apnea, we'll talk about CPAP, which stands for continuous positive airway pressure. And essentially it's a machine that creates air pressure to help you breathe at night. That's the most common and most effective form of treatment of sleep apnea. And I would say probably 75% of patients end up going down that route for treatment. The other type of treatment would be a dental device. And a dental device is a mouth guard that's created by a sleep dentist or a dentist who has an interest in sleep medicine, with the idea that it helps to push your lower jaw forward at night in order to help your breathing. It helps to stabilize your airway, and it helps you to breathe better at night. You know, there are some people who have milder cases of obstructive sleep apnea, and what they can do to help treat that would be to sleep on their side more than their back. And also getting allergies treated, because in the Central Valley, you know, there's tons of allergies and asthma that goes around that can really have a big impact on your ability to breathe. And so, you know, those might be first steps that we take, but typically we would then progress to other treatments like use of CPAP or a dental device.